now about whether or not Fred Upton's bill in the House will move forward. This bill would dramatically gut the ACA. Democratic Congresswoman Jackie Speier of San Francisco joins me now. She serves on the Oversight and Government Reform Committee. Congresswoman, it's good to have you here. And as my colleague Chuck Todd put it, there was widespread panic among Democrats in Washington this week. So not everybody is sold on the president's so-called fix that was given to us yesterday. And the president's going to go to the well one more time to ask for the support of the Democratic caucus. But is the well dry?
No, absolutely not. The well is full of water, to use your analogy. The members that spoke up were concerned that they were hearing from constituents that wanted to keep their plans because the cost of adapting to a new plan was going to increase their premiums so much. So they had really low-cost, catastrophic care, and they wanted to keep it. And he made that commitment to the American people. We made that to the American people, and so we're going forward and keeping that promise.
All right, but meanwhile, we have the president coming out saying that no matter what happens right now with the Upton bill, that he would veto it, saying that the work you're doing really is an effort in futility in the House. But some Democrats say that they're actually going to support this. And we've got two Senate Democrats, in Mary Landrieu and Mark Udall. They've offered alternatives because they know the Upton bill essentially guts the entire health care law. Democrats are trying to figure out something that looks like a fix, but then doesn't undermine the entire law in spirit. And then if we look at Minnesota Congresswoman Michelle Bachmann, she was out there this morning gloating about what's taking place with the ACA. Here's just a small clip of what she had to say.
Again, the American people expect competence. They expect their lives will be better, not worse. We hate to say we told you so, but quite honestly, we all look like geniuses now.
So do you think that the right and Michelle Bachmann, they all look like geniuses now because of what's happened with the ACA rollout?
Anyone that calls himself a genius is suspect in my book. The truth of the matter is that Americans are grateful for the Affordable Care Act. There have been 100,000 that have signed on to the regular program. There's 400,000 that have signed on to the Medicaid expansion. I just had a constituent who wrote me last night who said, you know, I was on Kaiser, but I lost my job, my COBRA expired, and I was going to have to pay $1,000 a month, so I dropped it. I'm 60 years old. I now went on, I got my coverage, I'm going to be paying $25 a month. That's the kind of stories that aren't getting out. And I think we've got to make sure that all the good news stories are getting out as well.
Do you think it's a false equivalence, though, because many of the headlines are saying that this is President Obama's Katrina moment or Monica moment or Iran-Contra moment? Do you think that's a false equivalence?
I think it's hyperbolic, and I don't think it at all compares. Let's be the health care plan is going to work. It has had some hiccups, but it is going to work over the long term. Much like Medicare, when Medicare first rolled out, everyone was crying and wringing their hands. Ronald Reagan said, this is the death knell for this country. And you couldn't pry a Medicare policy away from a senior today, nor should we. It is one of the bedrocks that keeps them out of poverty. And we're going to see over the long term, this is going to be healthy for all Americans.
Congresswoman Jackie Speier of California will let you get back to work. Thanks for your time this morning.
My pleasure.
Jonathan Gruber is an economics professor at MIT.